Greetings everyone. In this video we will study about hypothyroidism. Hypothyroidism is a condition, as the word suggests. Hypo means decrease, thyroidism is thyroid hormone. Okay, it's a condition in which thyroid hormone level it decrease in body. Okay, first of all we have to know that what is thyroid hormone. Thyroid hormone is a hormone which released from thyroid gland, which present in neck region, and its main function is it increase body metabolism, it increase energy production in our cells, and it increase sympathetic nervous system effect on body. Then come to hypothyroidism. Hypothyroidism we are discussing. In hypothyroidism, thyroid hormone decrease. Okay, hypothyroidism, first of all we talk about causes of hypothyroidism. What are the causes which cause hypothyroidism? First cause is iodine deficiency. Iodine is the main precursor to form thyroid hormone. Okay, iodine is a precursor for thyroid hormone production. Okay, then if thyroid iodine is not in body or deficient, then patient can go into hypothyroidism condition. Then second most common cause is Hashimoto disease. Hashimoto thyroiditis. It is an autoimmune disease in which body immune cells start producing antibody against thyroid gland cells, and which will lead to decreased production of thyroid hormone. Third most common cause is surgical removal of thyroid. For example, a patient had surgically removed thyroid gland. If thyroid gland removed, then no thyroid hormone will produce. Okay. Then fourth most common cause is uses of some drugs. For example, lithium can decrease sensitivity of thyroid stimulating hormone receptors which are present on thyroid gland, which will lead to decreased production of thyroid hormone. Okay. Then come to clinical features about hypothyroidism. Okay, clinical features will occur due to decrease in thyroid hormone level in body or thyroid hormone function. First clinical feature we'll see in patient is myxedema. Myxedema is a edematous swelling on face, feet and hands. It occurs due to a combination of some mucopolysaccharides. Thyroid hormone regulate the balance of mucopolysaccharides or other proteins in our body cells. Okay, when thyroid hormone decrease, metabolism will decrease, and their metabolism of these mucopolysaccharides, for example, glycosaminoglycans, GAGs, which we call, and this metabolism is essential to regulate. If this metabolism not occur in body, then these GAGs and these mucopolysaccharides start depositing in our tissues. When these GAGs depositing in our tissues, this will lead to attract more water in tissues, and it leads to imbalance of fluid in body, which will lead to increased fluid uptake in our cells. Okay, then what will happen? This will lead to accumulation of water with GAGs, which will come out as edema, which we call myxedema. Okay. Then second most common clinical feature, patient present with weight gain due to decreased metabolism, decreased breakage of fats, decreased breakage of proteins, which will lead to increase their accumulation in body, which will come out as weight gain. Okay. Third most common symptoms will appear in patient is that, according to bradycardia, decreased heart rate, which we call, and decreased cardiac output. How it happened? Okay, look. Function of thyroid hormone is that it increases expression of sympathetic nervous system receptors on heart cells. When this receptor expression start decreasing and sympathetic nervous system activation upon thyroid hormone decrease, when this happen, then the function of the contractility of cardiac muscles will decrease. If cardiac muscle contractility will decrease, then it will come out as bradycardia or decreased heart rate. If heart rate decrease, then obviously cardiac output also decrease. Then at the last, due to decreased cardiac output, and decreased metabolism, this low blood go into lung muscle cells. This will lead to decreased contractility of lung muscle cells, and when lung muscle cells contractility will decrease, this will lead to shortness of breath. Okay, This clinical feature will appear. Then come to GIT. What symptom will appear according to GIT? The main symptom will appear is constipation. How it occur? As we know, thyroid hormone receptors are present on GI tract. Okay, the main function of thyroid hormone on GIT is increase the motility of intestine. Okay, it increases motility of intestine. When its receptor will decrease or when its function is decreased, then motility or movement of intestine will decrease. When intestine movement decrease, this will come out as constipation. ठीक है? Okay, due to decreased motility, constipation will occur. Then, according to CNS, what symptom will appear? Due to decreased sympathetic nervous system effect on brain cells, the mental activity will also decrease. As we know, sympathetic nervous system activate our nervous system and make it awake for any situation. When sympathetic nervous system activation decrease or sympathetic nervous system effect will decrease, the brain will go into slow mental activity. Okay, and this patient present with slow mental activity. Then come to muscles. On muscle weakness will appear in this patient. Why? Because when low metabolism occur, when metabolism decrease metabolism, which will lead to decrease energy production. When energy production decrease, muscle will go into fatigue and muscle contractility decrease. When muscle contractility decrease, the patient will present with muscle weakness. Okay, then come to next phase. Next symptom is oligomenorrhea. Oligomenorrhea is infrequent menstrual periods, and this occur by I discussed with here. Look here. Look. Here is hypothalamus. Release thyrotropin releasing hormone, which go into anterior pituitary, and in the anterior pituitary it stimulates anterior pituitary specific cells, which we call thyrotrophs, to release thyroid stimulating hormone in circulation. This thyroid stimulating hormone will go into thyroid gland, where it will produce thyroid hormone. This is the normal process of thyroid hormone production. When thyroid hormone decrease in body, this will go a negative stimulus for hypothalamus, and hypothalamus direct it and start increase releasing thyrotropin releasing hormone, which will go into anterior pituitary to stimulate the anterior pituitary cells to increase production of thyroid stimulating hormone, so that it can compensate for production of thyroid hormone. When thyrotropin releasing hormone increase, thyrotropin releasing hormone receptors are also present in another cells of anterior pituitary, which we call lactotrophs. Lactotrophs are cells which produce prolactin. As thyrotropin releasing hormone receptor present on lactotrophs, if thyrotropin releasing hormone increase, which will lead to increased production of prolactin. When prolactin production increase, this will lead to, as we know, prolactin is inhibitor of gonadotropin releasing hormone, and it decrease the production of sex hormone, which will lead to decreased ovulation and decreased menstrual preparation, which will lead to decreased menstrual cycle, and which will come out as oligomenorrhea. The next symptom is hypercholesteremia. Hypercholesteremia is hypercholesteremia. Next symptom is hypercholesteremia. Hypercholesteremia is increased cholesterol level in blood. Thyroid hormone function is it increase expression of LDL or cholesterol receptors on liver and help to migrate all the cholesterol from blood into liver. If thyroid hormone level decrease, then receptors of LDL and other cholesterol on body tissues will decrease, which will lead to decrease migration of LDL to liver, which will lead to increase LDL in blood. In this way, when LDL increase in our blood and decrease in liver, which will lead to hypercholesterolemia condition. And this is the main clinical feature which appear in this patient. Then come to diagnose. For diagnose, we have to take medical history and physical examination. We will evaluate all these symptoms in patient, if these patient have these symptoms or not. But in this way, by physical examination, we can check that patient had or have hypothyroidism or not. Then second most common is test we can do is thyroid function test. In thyroid function test, we check in blood thyroid stimulating hormone and T3, T4, which are thyroid hormones. We check in blood, and in this way we can detect thyroid hormone produced. So then we can do thyroid antibody test. In thyroid antibody test, we will check the any autoantibody which are destroying thyroid gland. Then we can check imaging test, in which MRI or ultrasound we will check the thyroid gland and examine the thyroid gland. Then come to treatment. In treatment, we will give synthetic thyroid hormone which we prepared in laboratory, and this synthetic thyroid hormone will work as thyroid hormone and do all the function of thyroid hormone. In this way, thyroid hormone hypothyroidism symptom will decrease, and this is good treatment. This is all about hypothyroidism. I hope it was helpful for you. If you find it helpful, then please do like and subscribe. Thank you for your attention.